Hello students, in this video we'll be discussing about Parkinson's disease and anti-Parkinson's drugs. So the Parkinson's disease is usually characterized by the rigidity of the muscles, like the whole of the body muscles will be going into rigid state, which will be ultimately leading to the rigidity of the structure. There will be hypokinesia, tremors, defective posture and a shuffling gait. This is all because of the progressive loss of the dopaminergic neurons of the brain. So ultimately, if the patient is left untreated, there will be a state where he'll be unable to move, he'll be unable to breathe, and because of chest infections, he ultimately succumbs, he or she. So pathology, what happens for a patient who will be going through Parkinson's disease? There will be progressive loss of neurons, which are dopaminergic neurons in the substantia nigra of the brain. This is a scenario. What will happen? This is a normal person's content of the dopaminergic neurons, which will progressively keeps on reducing. So how to deal with it? How to replace the loss of dopamine which is being lost with the death of the neurons continuously? So we have a drug which is known as Levodopa. Levodopa only has the particular capacity to cross the blood-brain barrier. It has a particular structure. I have just represented it in a comic way, so that only if there is a particular structure, the levodopa will be allowed inside. Whereas the dopamine, which is the actual product which we need to be entering into the brain, will not be entering into the brain because it doesn't have the capacity to move through the blood-brain barrier. So only the precursor, the levodopa's precursor will be only, levodopa is the precursor of dopamine which will be allowed inside the brain to pass through. So levodopa, once it enters into the brain, into the nerve cells, it just goes inside the neuron and it just gets metabolized into dopamine, and this dopamine will be stored inside the vesicles and will be released when and ever required. So this is the ultimate treatment for Parkinson's disease via levodopa, which can only pass through the blood-brain barrier. If we give dopamine, it won't be able to pass. So this is one of the first step of treatment. So ultimately what will happen is, if we give levodopa, when the dopamine levels starts rise, if the rigidity will be gone, the rigidity will be reversed, hypokinesia will be reversed, tremors will be normalized, and defective posture will be normalized, gait from shuffling to normal gait can be attained, facial expressions from a mask-like face, normal facial expressions will return, overall mood will also be returned. So on CVS, what will the dopamine do is, it also acts on beta receptors, which are beta 1 and beta 2. So it causes beta 1 as they cause tachycardia, and beta 2 they'll cause hypotension. Also in endocrine, the pituitary mammotrophes, the dopamine is inverse proportion to the prolactin, so that if dopamine increases, prolactin decreases. Pituitary somatotroph, this will be directly proportional to the growth hormone. So if dopamine increases, the growth hormone also increases. So what are the ultimate adverse effects? So what is happening actually? So in this, the neurons are dying day by day. The dopaminergic neurons are dying day by day. But we are substituting it with the levodopa, so the dopamine is still being produced here ultimately. So there is a loss, there is a gain, there is a loss, there is a gain, which means there is a gain of dopamine, there is a loss of dopamine, there is a gain of dopamine, there is a loss of dopamine. Between these five, there will be something called as dyskinesias which will be happening. So this dyskinesia will be characterized as choreoathetoid movements, grimacing of face, tongue thrusting. The different muscular contractions will cause differential tone in different muscles, which will ultimately lead to dyskinesias, and with the ultimate upsurge of dopamine, which will lead into the condition called as psychosis, which we have read in the antipsychotic topic and in the other video. So this will ultimately end up with the psychosis. Fluctuation of motor performance. So what happens is, whenever the drug is given at a higher at the end stage of the Parkinson's, almost all the neurons will be deteriorated, all the neurons will be died, few neurons will be left over. Whenever we give the drug, there will be onset of action of the levodopa for some time, but later on it just weans off. It just which we call it as wearing off of the symptoms. Here what is happening is, when at 8 a.m. for example, if we give the drug levodopa, all the symptoms are relieved, so the patient will be becoming normal. But by the time he reaches 10:30, the drug will be already used up by the neurons, so that he'll be coming back into the original state of Parkinson's disease again. bradykinesia will be coming up again. So at 12 p.m. again, actually the next dose of drug will be scheduled. By then, if he takes the next dose of drug, he'll be coming normal to back again. So this is called as on and off phenomenon. Whenever the drug's effects are there, it is called as on. Whenever the drug's effects are gone, it is called as off. So it is called as on-off phenomenon. So they'll be wearing off. So the drug activity will be there. It will be wearing off before the next dose. Again, when the person takes the drug, it will be acting and it will be wearing off before the next dose. So this kind of on and off phenomenon will be seen if we give levodopa in extreme conditions, not in the beginning stages. It is in the extreme neuronal loss. Now we have another class of drugs which are peripheral decarboxylase inhibitors. If you see this enzyme is the decarboxylase enzyme. It will always tend to break down the levodopa, which is precursor, into dopamine. So when dopamine is released, it can't cross the blood-brain barrier. So blocking this decarboxylase enzyme is utmost essential so that the levodopa stays intact and it will just cross the blood-brain barrier and it just enters into the nervous system. So examples of these carboxylase inhibitors are Carbidopa, Benserazide. You can remember it with the mnemonic Benscar. So they will prevent the peripheral decarboxylation of levodopa so that the levodopa stays intact and it will be easily penetrating into the blood-brain barrier. And pyridoxine, one of the vitamins we know, which it will act as a cofactor for peripheral decarboxylase enzyme. So pyridoxine should be inhibited from its action. Then we have this other class of drugs which are dopamine agonists. So we had dealt with this situation by giving levodopa as a supplement. It is breaking down to dopamine and it is coming and it is acting on the dopamine receptors. So instead of that, if we prepare few drugs which will act directly on the receptors, they will not be needing all this pathway to be happening. They'll directly go and act on the dopamine receptors and trigger them. This plus point is they'll act on specific dopamine receptors like D2 and D3. So we have examples of Ropinirole and Pramipexole. They'll act on the D2 and D3 receptors directly. And one theory states that if we give both levodopa and the dopamine agonists, the chance of neurodegeneration will be reduced because we are already supplementing the dopamine from above and also we are triggering the receptors from below, so that the neuron will not face much of burden to synthesize and produce dopamine on its own. So we are already supplementing the thing which the neuron has to do. And the other class of drugs are MAO-B inhibitors. These are monoamino oxidase B inhibitors. We have Selegiline and Rasagiline. So we have read the mnemonic as MAO-B, preventing the armrest to be sold. Armrest is this, selling this in the other video. So hope you watch that video as well. So this is known to be increasing the levels of dopamine in the synapse by preventing the dopamine breakage. So the wearing off effect, which is coming out very easily, will be sustained for longer duration because the dopamine will not be broken down for a longer duration because of MAO-B inhibitors. And we have COMT inhibitors, which we have examples of Entacapone, Tolcapone. So they will convert the levodopa into dopamine in the periphery itself. So we'll see in this image. So COMT, it will break down the levodopa into dopamine at the periphery. So they need to be inhibited. The examples are Entacapone and Tolcapone. And we have levodopa over here, which is being degraded by decarboxylase, which also should be inhibited. The examples are Carbidopa and Benserazide. So the levodopa should ultimately go into the nerve. It should get metabolized into dopamine. Then this dopamine should be stored in the vesicles, and from these vesicles it should be released into the synapse. So we have MAO-B, which is breaking down the dopamine which is being released in the synapse. So we have Selegiline and Rasagiline as MAO-B inhibitors. So the dopamine will not be broken down, it will be staying for more duration. COMT also has the action of breaking down the dopamine in the synapse, so it should also be inhibited. We have examples of Entacapone and Tolcapone. So ultimately our aim is to increase the amount of dopamine in the synapse over here. So also there is one more mechanism where NMDA receptor can be antagonized by the drug Amantadine, so that the Parkinson's disease symptoms can be cured. So if you want, please take a screenshot of this. I'll just give a clean frame of what happens in a Parkinson's disease, and this covers almost the entire treatment of the Parkinson's disease. We have decarboxylase inhibitors, COMT inhibitors, MAO-B inhibitors, NMDA receptor antagonists. Fine. So we'll go to the other class of drugs which are central anticholinergics, because as the dopamine neurons are dying day by day, the blocks of dopamine are getting reduced. So in order to balance the cholinergic system and the dopaminergic system, what we can do is we can just remove these blocks also, which we call it as anticholinergic drugs. Anticholinergic drugs. So if you remove these blocks of cholinergic system also, the dopaminergic system will be balancing with the cholinergic system. Ultimately, the coordination and the control will be in pace. So that is one of the treatment, and we have the example of trihexyphenidyl. If there is a drug-induced Parkinsonism, the treatment of choice will be this anticholinergic, which is trihexyphenidyl. Remember that. And we have another disease in this neurodegenerative disorders, which is Alzheimer's disease. In Alzheimer's disease, the gyri and sulci will be more prominent, and the brain will become atrophied for the patient who is going through Alzheimer's disease. What happens is there will be neurofibrillary tangles which will be formed across and around the neurons, and there will be amyloid plaques deposition inside the cells, which will ultimately kill the cell. The cell will die ultimately. Sadly, these neurons are prone to be mostly found to be cholinergic neurons. So people who are having a death of cholinergic neurons in old age will need replenishment or replacement of the cholinergic neurotransmitters, so that we can prevent the Alzheimer's from further progression. So what happens is, early signs, they'll be forgetting the recent conversations, the persons who will be suffering from Alzheimer's disease, and there'll be difficulty in recalling the names, places. They'll be forgetting the people whom they used to be with them previously. Ultimately, loss of everyday functions. They'll be forgetting all their personal care and activities also. So in order to treat these disease, we have to just replenish or replace the neurotransmitters. So for that, we have cholinesterase inhibitors, which means the enzymes which will break down the acetylcholine, the enzyme which will break down the acetylcholine should be inhibited, which are tacrine, rivastigmine, donepezil, and galantamine. These are the examples of the drug which are cholinesterase inhibitors. This cholinesterase, the acetylcholinesterase, will break down acetylcholine, so that if we inhibit this enzyme, so acetylcholine will be increased in the synapse, so that the Alzheimer's disease can be cured. And we have nootropic agents. These are cognition enhancers. We have piracetam and aniracetam. These are the examples. These are also helpful for better improvement of Alzheimer's disease. And we have NMDA receptor antagonist, which is called as Memantine, which blocks NMDA receptor, which is also helpful in curing or preventing the progression of Alzheimer's disease. Also, we do have Peripheral, which is agonist. We do have Peripheral, which is the dopamine agonist, and Ginkgo biloba, which is an herbal extract, which has an antioxidant property. These are all the drugs which we will be using for treating or used for the prevention of progression of Alzheimer's disease. So in order to remember these in a funnier way, I just made a mnemonic for Alzheimer's disease, where memory boosters will start here. The restaurant is claiming their quote with this. So what happened is, to the Memantine canteen, hope you understood the rhyming of this Memantine canteen. There is a girl named Ria who has this problem of forgetting things. Just remember it to be Alzheimer's disease. She just finished off a race. So race matlab piracetam. Remember like that. Piracetam is a drug which is used for the Alzheimer's disease. So she had ordered a tacos, which means tacrine. Tacos for tacrine. And remember Ria as Riva, rivastigmine for Ria, and donepezil is for payment. Then she just tried to do a payment to the shop, but she had paid it to the wrong QR because she just tend to forget things. So galat is gallant, galantamine for galat. So just did a wrong payment because she tend to forget things, and she just clicked on some other QR which is already there on her mobile. So with this, you can remember tacrine, rivastigmine, donepezil, galantamine to be the cholinesterase inhibitors being the treatment for Alzheimer's, memantine being the NMDA antagonist, and piracetam and anacetam being the treatment part for Alzheimer's disease. Hope you enjoyed this video. Thank you everyone. Don't forget to subscribe and like the channel. Thank you.